Namaskar, I'm Dr. Nisha Chaudhary from Eye Care Eye Hospital, and today we are talking about glaucoma. So glaucoma is a silent thief of sight. That means it leads to blindness, but it starts completely asymptomatically. So glaucoma is the disease of optic nerve, in which the optic nerve, which is responsible for the vision, signals from eye to brain, is getting damaged because of increased intraocular pressure. That means the pressure inside the eye. Sometimes, however, the pressure may be normal also. So glaucoma is silent, progressive and irreversible disease. Silent means that it is completely asymptomatic most of the times. Sometimes it may be painful when there is an acute angle closure. Otherwise, mostly it is completely asymptomatic. Progressive means in absence of any intervention or treatment, there is a progressive damage that is happening to the optic nerve. And irreversible means whatever damage has happened to the optic nerve is never going to be restored by any means of treatment. So who are at risk of developing glaucoma? Any person who is above 40 years of age, any person with family history of glaucoma, any person with diabetes, hypertension and thyroid disease, or any person who has suffered trauma in the eye at any age, people who are taking steroids in any form, it can be eye drops, tablets or even inhalers, or any person with high minus or high plus power glasses, high myopia or high hyperopia respectively. So these people should always get a routine examination by a good ophthalmologist. So what all we have to see in routine glaucoma examination? So there are basically 6 things that we check in a glaucoma workup. First thing is the intraocular pressure. That means the pressure inside the eye. This is the only modifiable factor in glaucoma treatment. Second thing is the gonioscopy. We check the angles of the eye, the drainage pathway inside the eye. This can be checked by putting a lens over the eye. Third thing is the optic nerve examination, which is also done by your ophthalmologist through a lens. Fourth thing is the visual field testing, in which the peripheral vision of the patient is checked through a machine called perimeter. Fifth thing is the OCT, which picks up really early glaucoma before any vision loss happens. And just to complete the list, sixth thing is the corneal pachymetry, which checks the corneal thickness, which can be affected in the intraocular pressure measurement. So once you're diagnosed with glaucoma, how do you manage the disease? First thing is the anti-glaucoma medications or the eye drops, which are available, which reduces the intraocular pressure. These are the most commonly used treatment modality. Second thing is the laser trabeculoplasty or peripheral iridotomy, depending upon the type of glaucoma you've been diagnosed with. The third thing is the surgical intervention, which involves the implant devices which are implanted into your trabecular meshwork, or any filtering surgeries which are usually done in advanced glaucoma or rapidly progressing glaucomas. So once you're diagnosed with glaucoma, to prevent blindness, there are 4 important things which are to be taken care of. First is the follow-up visits. You must adhere to your follow-up visits as recommended by your ophthalmologist. The visual field testing or OCT testing, again as recommended by your doctor. Please strictly adhere to the eye drops that have been given to you. Be punctual in your timings. Encourage your family members to have a screening test. Glaucoma is asymptomatic to begin with. And why? Because the glaucoma is hampering visual field. So the brain is compensating for the vision field loss in early stages. But in the end stage, when the patient comes to know that he or she is having visual problems, it is usually very late for us to manage or to prevent blindness. So remember, glaucoma is nothing to fear of. It is just that we have to diagnose it early, manage it properly. Consistent follow-ups, adherence to your treatment is the key to prevent vision loss later in life. Thank you.